Our work focuses on summarizing a variety of clinical practice guidelines and high-yield trials on perioperative management prior to non-cardiac surgery. I'm Mike Byerly. I'm an internist with the Division of General Internal Medicine at Mayo Clinic in Rochester. I'm an assistant professor of medicine, and our paper is titled The Preoperative Evaluation Prior to Non-Cardiac Surgery. In our paper, we identify high-yield items to consider for patients prior to undergoing surgery. Our goal with this paper was to condense a very broad and highly decentralized body of literature into a concise, easy-to-use document to guide the non-specialist in providing perioperative care for the increasingly complex medical patients we are asked to evaluate prior to undergoing surgery. Most patients who are evaluated prior to surgery are able to undergo surgery with minimal or no testing. One of the keys is to consider how your testing preoperatively will impact the patient's health in a broader non-perioperative setting, as many of the things that are helpful in the non-perioperative setting are also relevant in the preoperative setting. One of the opportunities for improved cost efficiency and improve satisfaction is to reduce the amount of unnecessary testing, especially testing that won't change the management of our patients either in the preoperative or non-perioperative setting. From the patient's perspective, this process will provide an overall look at their health to make sure that we're able to perform procedures as safely as possible. The goal is not to prevent people from going to surgery, but instead to identify patients at higher risk so we can provide additional resources to identify complications early and take steps to try to reduce the risk of serious complications from developing. From a clinician's point of view, this information provides a basic framework to begin structuring your preoperative evaluation using the best available evidence. As many of the perioperative guidelines are only addressing one or two organ systems, our paper provides a unique perspective in bringing together these multiple sources of recommendations into one consolidated resource. Consistent throughout many of the resources we reviewed is the fact that many different types of clinicians should be thinking about perioperative medicine from the conception or the consideration of surgery. The perioperative period is traditionally defined as 30 days before surgery, but especially as we're looking at higher risk populations of patients who would benefit from interventions such as prehabilitation, considering the ways that we can improve our patients' perioperative outcomes should really be the responsibility of all providers, not just surgeons or anesthesiologists, and should begin as soon as we start to think that a surgery may benefit a patient. In summary, patients benefit from a comprehensive preoperative evaluation to guide cost-effective, hypothesis-driven testing to try to identify patients at higher risk of complications so we can reduce adverse effects. The goal isn't to clear patients for surgery or to deny patients access to surgery, but instead provide a vital role in optimizing medically complex patients prior to surgeries that may benefit patients from a life expectancy standpoint or a quality of life standpoint. I'd like to thank Dr. Nath for the opportunity to disseminate our work, and I hope you enjoy our paper.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.